Welcome to my 37 weeks pregnant vlog. I'm actually really excited. We are going to kick off this week with a pelvic floor examination and just to learn from a team about why it's so important to be aware of your pelvic floor. I do work on some exercises and some breathing techniques on my own, but I just wanted a little more insight on what's going on with my body during this pregnancy and what my focus should be postpartum. So I'm going to bring you guys with me. I'm so excited. So I'm working with the Pelvic Health Center in Madison, New Jersey. So I'm excited to just share this with you guys. I hope you take away some tools. The belly is bumping. I'm feeling really good. Just feeling really heavy at night, super full. And I just have to be horizontal after a busy work day and then taking care of a toddler and just like nesting beyond and all the things preparing for labor and delivery and postpartum. It has been a lot. So I am just taking it day by day. We're due in 17 days or something like that. Crazy. It's just a couple weeks away. So we'll see when we go. Right now I'm still only 1 centimeters dilated and 50% effaced. So I'll see my doctor every week to try to track progression. And we go from there. So I'm really hoping that I can go into labor naturally. And in this vlog, I am going to do all those things to hopefully help the natural induction process. So eating dates and inversions and curb walking, different stuff like that. Raspberry leaf tea. It's just you don't know what's going to work, but you control what you can and you accept what you can't. So we're going to do them and see what we can achieve. But anyway, let's go into this appointment and I'm excited you guys are here. I'm joined by Shauna. She is a pelvic floor physical therapist, and we are going to talk about why the pelvic floor is so important to be aware of, not only during pregnancy, but pre-pregnancy, during, and postpartum. We are going to go over what my body is going through deep into the 3rd trimester. I'm going to be delivering a baby within 2 weeks. So I definitely work on a lot of exercises at home and breathing techniques, trying to hug my baby, deep belly breathing, that sort of thing. But I would love to hear more from you about why it's so important to be aware of your pelvic floor, especially when it's working in overtime to support your growing and weight of a baby.
So the importance behind being so aware of your pelvic floor, and it's not just pelvic floor that we just look at. We look at the whole body in general. We look at your flexibility, your range of motion. We also look at, glute strength, posterior chain strength, so the back of your body. It's not always just the core exactly in the pelvic floor. It's always everywhere else. And it's really our job to make you more aware of these changes and be able to be more cognizant so you can be able to address these changes accordingly. So basically, we educate the client, and you educate us on what's going on with you so we can better accommodate you through peripartum, postpartum, and beyond even, and to continue on from there.
So I'm a personal trainer and I have a lot of clients too that the first thing that they think of is, oh, when I cough or I sneeze, I pee, or when I do jumping jacks, I pee. And that's the main thing people correlate with the pelvic floor, after having babies. So explain to me, where does that come from? And it already sounds like it's way beyond just that, but that is a common symptom, right, for many women that struggle with pelvic floor issues.
So we deal with a lot of that. That's the most common complaint that we do see here, peri and postpartum. So peri means during pregnancy. So it's because our intra-abdominal pressure, so meaning that we go from the chest all the way down to the pelvis, that pressure gradient system ends up changing because you're growing a baby. There's going to be how many pounds of like
Losing
baby
room.
in there? Yeah, exactly. How many pounds of baby in there? It's going to push up on your diaphragm. It's essentially moving your internal organs out of place or out of the way to accommodate that. So the breathing mechanics ends up changing, meaning the pelvic floor mechanics ends up changing. So as a good example, the diaphragm is up here, the pelvic floor is up here. So for your viewers, you inhale, you allow the diaphragm to come down to accommodate, guess what, your lungs. And it's going to push down on all the abdominal contents, and guess what's happening to your pelvic floor? It's going down. So when that all changes, that's going to cause the diaphragm to not move properly while the pelvic floor just kind of stays stationary. So guess what? More pressure on the bladder. So, yeah. And also, the core stability work that we do provide for our patients does actually improve that.
That's okay. So the core stability work that you do with your patients.
Yeah. So the core stability work that we do with our patients actually improves that intra-abdominal pressure so that the pressure gradient can be like processed through evenly and appropriately.
Okay.
But also, the strength in the pelvic floor can also be altered because you have hormones that are being like released into your system to allow like the pelvis to essentially separate and push out a baby. So sometimes the recovery can be like a little slow because it's overstretched. Think about it like a rubber band even, and how it just is like, okay, slowly get back in. So
you have to have time and patience, and you actually have to like practice the poses and the breathing to really strengthen and improve overall.
yes, absolutely.
Okay, are you ready for my exam?
Yeah, absolutely. So for a lot of our peri and postpartum patients, the common complaint is separation, so diastasis recti. So we always double check to see if there's a presence of it, the degree of it, and sorry.
That's good.
So we check for the presence of it and the degree of separation.
Okay. And most women, a high percentage of women have separation even if they don't know it, right?
Yes, absolutely. Yeah.
Okay.
I always start above and below the umbilicus, so your belly button here. That's where your linea alba kind of starts, and which is the middle of your six-pack muscle, your rectus abdominis. So we kind of go from here and down, and it comes up to your xiphoid process, so underneath your sternum right here, and then all the way down into your pubic bone. So we'll start right up here. So usually with the presence of a diastasis recti is classified as 2 finger widths. Usually we like to see like a little less than that for no presence of diastasis. So what I'm gonna do is gonna start above your belly button, and what you're gonna do is lift your head and shoulders off of the table, and that's how you see it. So it seems like just a little bit more than 2, so maybe about 3 here, and come on down, which is not entirely uncommon to see here. So I'm gonna make my way halfway up. I don't have to like check every inch of you. Okay, let's go up. So about 3, and come on down. And just right under your xiphoid process, just a little close. We don't want to hit that because that's a sensitive area. And again, good. So you're consistent 3 fingers width deep, wide, and what we also check, not only just width, but we see the depth of it too.
Okay.
So we'll come right into the middle here and come on up. So we're about up to my fingernail right here, so lay back down.
Okay.
If I tend to be like a little bit more detailed, I usually take a pen right here, mark that off, and I measure in like centimeters. Yeah. So it's like if you're really looking to like keep an eye on that, yeah, we measure up on our fingers. Okay, so now below the belly button. Yeah. And wider than 3, but I wouldn't classify that as 4. Okay, again. Yeah, about, yep, that. 4, and let's go just above the pubic bone. How you doing so far?
Good.
Good.
I'm surprised she hasn't kicked yet towards you.
Can you lift up just a little bit more? Yeah, so once we get a little bit lower, sometimes you just need to bring your head and the shoulders up just a little bit. Yeah, a little bit higher. And then let's just check the depth here. And let's go. So a little bit past my fingernail. We're finding that we have like a 3 finger width diastasis with like a fingernail depth of diastasis recti. And then as we come down here, there seems to be about 3.5 to 4 finger widths, just like a little bit deeper than that. It's not entirely uncommon to see like more of a separation below the umbilicus versus above the umbilicus because of the way that the baby's weight is being distributed, especially in your final weeks of pregnancy.
Yes, her head is down, so that's probably why, right?
Yeah, it's getting ready.
So based on my diastasis recti diagnosis, what are some of the top exercises that I could do at home that could help me with my recovery, in addition to wanting to come to a specialist like you guys and deepen that work?
So one of the main exercises we do end up teaching, it's actually like a few exercises in one, our vacuum series. That seems to be the most helpful. That's like our key exercise program that helps our peri and postpartum patients like recover from that diastasis recti. So, ready?
Yep.
Yeah,
ready.
Let's start. So you're gonna lay on your back flat. Okay, beautiful. You're gonna straighten out your knees. So remember how we were talking about posterior chain strength and activation?
Yes.
So we're gonna do exactly that while trying to cinch and hug the baby in.
Okay.
So what I tell all my patients to do is make a very tight fist and tight fist. You're gonna keep the elbow straight, push down into the table. So you're already starting your activate your upper quarter posterior chain. So I shouldn't even be lifting you off the table. Yeah, bam, bam. Activate your quads, straighten out the knees, dorsiflex your ankles, so point them up towards the ceiling. You feel everything now is like turning on. So you take a deep breath in and fill up the belly, expand. And as soon as I say exhale, you exhale. Bring that belly in, flatten the back, keep everything tight, and you hold that for at least 5 to 10 seconds. All right, inhale, exhale, and really loudly. There you go.
Should I breathe out? Actually breathe out, like make a noise? Or...
Like
Oh, okay.
Or
okay, so in through the nose, out through the mouth?
Correct.
Okay.
Exhale, go. Cinch that belly in, hold that in. Yeah, you see that descending. Exhale, flatten the back out, tuck the ribs in. Yeah, I'm gonna check.
Woo.
Yeah,
I felt that. Okay. That's good.
Yeah. So that's like a very good add-on for the deep breathing that you've been doing all along. The deep breathing is excellent just to kind of turn on the lights on your transverse abdominis. Great starter. This is a great second step for you.
Okay.
Now, next step here, so exercise number 2. We bend the knees. So we're gonna follow the same course, chain of events. So we're gonna start with activating the upper quarter posterior chain, but now we're gonna get a little bit more glute activation here via bridging.
Okay.
Yeah, and now we're adding in the dynamic movement, which is great for carryover.
Yes.
Yeah. All right, so make fists, activate the elbows, Take a deep breath in. Exhale. And now lift, 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 lift. So we're going to hang out here for a second. So if I were to take a toy car and just throw it down your leg and let it go, 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 aside from the baby being in the way, it'll go in a straight line down your front of your body. Yeah. And bring it down. Okay, so you inhale. Cinch everything in. Yeah, good. Nice, nice. Yeah.
Ooh, I feel it.
Yeah, a lot of core, right?
Yes,
Glutes a little bit. This is the type of stuff, keep going, that we encourage a lot of our patients. Like, it depends on like who you're talking to, post-prostatectomy, postpartum, to focus on breath control, because that transverse abdominis, according to motor control theory, very specific physical stuff, that the TA, the transverse abdominis, is the first muscle to be activated during functional activity and exercise activity too. So if we continue to, tell you, focus, 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 that carryover is gonna occur in later exercises and later functional activities.
Okay, wow.
Yeah.
I love it. Okay, so we got 2 exercises. We're going to go for one more.
Yes,
Okay.
so now we're gonna add more dynamic leg mobility. So you've already done supine marches.
Mm-hmm.
Now we're gonna step them up a little bit.
Okay.
So again, activate, activate. And exhale. Oop. So that's bridges.
Now we're, okay, but sorry.
That's okay. Yeah, I thought we were on the same page.
So do you want me to just here then?
Yeah, we're
Okay.
just gonna,
Okay, so just draw it in like this?
Yes.
Flex. Okay,
Exactly.
Let's start over from the 3rd.
Okay. So now we're gonna start with supine marches. So that's gonna be a little bit of a step up from what you usually do. So what I want you to keep in mind is bring that knee and just above your hip right
Okay.
there. Yeah. And just gently bring it up. Keep exhaling. And keep exhaling as you control the motion down.
Got
Yes.
it. Okay. Here we go.
All right, let's do it. Inhale. Exhale, cinch everything in. Keep exhaling, keep that back flat. Excellent. So also another thing to keep in mind is make sure that the belly button is drawn upwards a little bit. Yeah.
And that is on the inhale or the exhale?
The exhale.
Okay.
Mm-hmm.
Okay.
Inhale. Exhale. Good. Yeah, you feel a little difference there? Yep.
Bigger difference, yes.
Yep.
Okay. So, and it's important to go up again. Why? To make sure that you're bringing your diaphragm up and not just out.
Yes, correct. Okay. Yeah, that'll encourage that diaphragm to continue to push on the lungs and encourage more cinching of the TA.
Okay.
Just remember, the TA is a corset muscle, so think of that kind of coming inwards in on itself.
Okay.
Yep.
One more?
Let's do one more. All right. And exhale, bring that in, cinch it in. Excellent. You want that tight up there.
Yes.
Excellent. High five.
That's good. So how often would you recommend someone go through those 3 exercises? Daily, multiple sets, for time? What would you say?
So for me, I work on quality over quantity. So I usually tell my patients like at least 10 to 20 times per set, 3 times a day.
Okay.
But if you can only muster, let's say 10 like very good reps before you really start losing control, meaning fatigue, then that might be it for you today. But if you can be like, okay, I can do another 10, like 30 maybe, then that's okay. Like,
so just base it on how you're feeling, just like anything. If you're feeling good, you can go a little more. If you're having a rough day, just do what you can or rest.
Yes, exactly.
Okay, well, this was so informational. I appreciate everything that you gave us insight-wise. Last question I wanted to ask you is, so many people think that their pelvic floor is shot for life, that they're never going to recover, that they're always going to have separation or coning, or they can't do planks ever again. What would you say to people that are faced with that or believe that?
I would say it's never too late to help your pelvic floor or help the recovery postpartum. We've seen folks that come in to see us like years after the fact and think that there's little to no hope, but we'll be able to bring that hope back to you guys and be able to help you recover as quickly as possible.
Come back stronger and better, right?
Absolutely.
Our bodies are fascinating and strong. So thank you so much, Shauna. I appreciate it.
Ashley, it's been a pleasure.
Pelvic floor. Everybody thinks pelvic floor originates down here, down under. That's what everybody calls it. It's nothing down under. Pelvic floor actually starts at your mandibular line, your platysma, inserts into your clavicles, comes down as the anterior fascia, inserts into your pubic bone, wraps around, inserts into your little tail, right, tailbone, comes up as sacral tuberous ligament, inserts into your SI joints, comes up as thoracolumbar fascia, which inserts into your thoracic spine, becomes ligamentum flavum, inserts into the base of your skull, and then becomes connective tissue and inserts into the orbit of your eyes. We are a giant diaper from the front to the back. So when somebody says to me, I have pelvic floor dysfunction, I go, not down here, come up, you gotta come up. We have to start from your chest. All of it needs to open up, front and back. This is the rule. Whatever you see in the mirror, work it once. Whatever you don't see in the mirror, work it 3 times. That's the ratio. Nobody wants to work your back. Who likes to do Superman? Nobody. Who likes to do quadruped positions? Nobody. That is what exactly we need. Work your multifidus and your extensors 3 times. Do not crunch your abs as much as you want to. We all want this. It actually comes from here. Just like I said, diastasis recti, even though it's here, it originates in the thoracic spine. So stretch your thoracic spine, make your multifidus stronger.
So beyond the one-on-one therapy, what are some back exercises you could do at home to help your posterior chain?
If you have a wall, we all do, right? You could do step through. Take a towel or a ball, roll it up, contract your abs, and bring it down. You see, it all engages your multifidus muscles, your back extensors, right?
Yes.
Right.
Okay.
You could do girl push-ups. Everybody does that, right? But don't forget to tuck your chin and do gentle push-ups and make sure your scapulas are moving to activate your rhomboids, right? Always remember, you want to strengthen your back and you want to stretch your front. So do your pec stretches to stretch your front, right? 1 side, 2 sides. Don't forget to also do your chin tucks because we want the cervical spine to be nice and stable. So the minute you protrude your spine, you just lost that posture. So all this stretching was for nothing. So bring your chin back and stack it on top of your thoracic spine, right? You stretch your pecs, you strengthen your rhomboids through gentle push-ups, right? Anything exercise where you're on your hands and knees, it will lock your scapula. So it doesn't matter what you do. You want to do fire hydrants? Great, right? You want to do your donkey kicks? Great. Just lean on your arms. Don't tuck your head. Chin tuck, scapula. And then do any circles you want, any kicks you want. But to maintain that position, to fix the thoracic spine and make it stable. Sit down. You have a TheraBand. Sit down on a ball and use the TheraBand and lift it up and down. Here comes your multifidus.
Okay, so there's so many things we can do.
Yes.
So I asked this question to Shauna, and I would love, it's our last question. For women that think that there's no hope to recover their pelvic floor, their ab separation, they think they're always going to pee for the rest of their life, they're always going to have lower back pain, what would you say to them?
Absolutely not. Every single woman who comes to us, some women come when the kids are in high school and they say, it's been 15 years, there is nothing to fix. I go, absolutely, yes you do. Connective tissue can be stretched, pressure can be changed. You could always stretch it and you could always strengthen. What I love about pelvic floor is we take you as one giant unit. We never just spot treat you, right? We'll take you as one giant unit. We modify your cervical spine, modify your thoracic spine, lumbar spine, sacrum, strengthen your glutes, strengthen your pelvic floor, fix a little bit of your gait. So you actually become, after pelvic floor therapy, well-adjusted human being. And now we could tell you, when you go to the gym, this is what you can do, but this is how you might fail. So you become so body aware. So I think every woman needs to at least have one session with a pelvic floor therapist to learn about their body, because after birth, it's a brand new body, right? So how you were with the first baby, how you are with the second baby or baby number 4, it's completely 4 different human beings that you have to learn about. So how you were with the first one, you just had one. You were able to take naps. With the second one, you're chasing a toddler and a newborn. By the 4th one, you've lost your mind already. You're not resting, you're not eating, you're constipated, and you're just so frustrated. You're not healing. So your recovery will be slower. But there's hope for everyone. So I think if you're in doubt, just go and take one eval with a pelvic floor therapist. It's gonna blow your mind how much you're gonna learn.
Okay, I'm back from that pelvic floor examination and it was awesome. Knowledge is power. I think it's so beneficial to know how your pelvic floor is being affected during pregnancy, because it is taking a beating in the best way possible, growing a human. But it also just gave me confidence and clarity on specific exercises that I could be doing to benefit my diastasis recti, and just confidence that I can rebuild my core postpartum. So it's never too late. I'm even starting a lot more breathing exercises and techniques now leading up to delivery within a couple weeks. But I am in my home studio. This is where I personal train my clients. I'm a personal trainer and nutrition specialist. So this is where all of the fun happens. It also acts as a playroom for my son. On this side, there's all these cars and toys and everything. But I just sat down to make my nurses' gifts and doctors' gifts. Basically, it's a way for me to say thank you to our medical team for the attention and support that I hope we will be receiving during a very emotional and physical, challenging time. It's the most beautiful time, but it's also very scary at times. So when you find someone, when you come across someone who is genuinely caring about your personal journey, it really does make a difference, and I want to say thank you to those people. So I will show you what we're making, but they're these little tiny gift boxes filled with some goodies that I hope our medical team will enjoy and appreciate. I got these little cute gift boxes from HomeGoods. These are obviously like Valentine's Day themed, but they work because we're having a baby girl. So they were so cute. They were only like $5.99 for 10 of them. And then in them, this is a winner. Everyone's going to get a $5 Starbucks card, which should get them a good drink, some dark chocolate almonds, and my favorite facial mask and serum from Beauty Counter. I am a rep and I just love handing out my favorite samples. So this is what it will look like. Cute little thank you gift. I love it. Speaking of coffee, this is just pure concentrate, like a cold brew. And then you have to even it out with water and a splash of almond milk and some coconut sugar. And then this is how I get my water in daily through pregnancy. My Stanley, 100% recommend. It keeps everything nice and cold. I love the handle. It fits in my car holder, my car cup holder. And that's 40 ounces. So I drink minimum 2 of those a day. And water is just great. So many benefits. Obviously, hydration also prevents preterm labor. But I am 38 weeks tomorrow. So not that I'm ever going to try to dehydrate myself, but it's been my concern going through my whole pregnancy to make sure that I'm getting enough water. Yes. You say hi to doggies. It's the next morning and I made this little bear heart Valentine's Day breakfast for my son, inspiration from Pinterest. I will show it on the screen, but I think it turned out great. So it's just oat flour and buckwheat flour pancakes mixed with egg and banana. And then I made a little bear with raspberries and more banana and blueberries, drizzled maple syrup. And then I got his milk and juice ready and this cute little book we're gonna read. He is still sleeping, I can't believe it. And now I'm going to have some coffee. I need this fuel so much right now, hence the mug. I will link this below. I love this mug. I'm drinking Scout and Cellar coffee. This is clean crafted coffee. My mom actually sells this, and I'll put her information below, but they just go through a rigorous process to make sure that the coffee is not filled with crazy additives, and I just appreciate that, and it's so good. And then I sweeten my coffee with a little coconut sugar, and my almond milk is frothed on top. I'll probably show you guys how I make my almond milk. It's so easy. I try to do it 1 to 2 times a week, and it's just naturally sweet, but I did add a little more coconut sugar on top, and it is so good. And I'll show you my frother because my frother is amazing. This is the frother, and basically you just pour your milk of choice in here. There's a line, and then you just press this button and it froths it so nicely. I literally use this probably every day. It's the best. What's that? Pancakes with heart and bananas. Mmm. Yeah. Now I just made my pancakes, and these are simply just organic rolled oats from Bob's Red Mill, and 1 whole egg, 1 egg white, 1/3 of a banana. You just mix everything up. You get a batter consistency. I threw in about 10 chocolate chips from HU or Hue Chocolate, which is also like a great baking mix chocolate company. I love them so much. And it made me these 3 really good pancakes. And then on top is 1 tablespoon of mixed nut butter from Costco. Trader Joe's also has a really good option. And then I just drizzled about a teaspoon of pure maple syrup on top and then shook some cinnamon. So this is mine. I love this option because it has my carbs, my protein, my micronutrients, and my healthy fats all in one yummy, delicious meal. What's that? Pancakes with heart and bananas. Mmm. Yeah. You're just gonna go for the fruit first?